A new study on Ozempic and your dopamine raises the alarm. It just got published, and the authors were very concerned that if you're using drugs like Ozempic or Mounjaro or all of those GLP-1 drugs, that could lead to depression and even suicide in certain people. I had even interviewed one of the authors on this paper, Dr. Nicole Avina, and I will link the interview that we did on food addiction at the end of this YouTube video. I was fanning out because when I studied food addiction for 7 years at the University of Miami to work on my dissertation, a lot of the papers that I had to study were actually authored by her, so it was great that I got to meet her. And now this new paper she came out with is really exciting to share, but at the same time really sad and alarming. Hi, I'm Dr. Zaldivar, and I lost and maintained 35 pounds mainly by targeting my baseline dopamine levels. That was the topic of my dissertation. And I quit decades of teaching at the University of Miami and the American College of Sports Medicine so I could reach a wider audience online. Here are the key takeaways of this new paper. This paper showed how chronic use of these weight loss drugs like Ozempic and similar drugs can destroy your dopamine receptors and dopamine signaling in the brain. It is similar to somebody taking cocaine or eating a lot of addictive foods or using a lot of drugs. Over time, the use of those substances destroy your natural production of dopamine. In other words, your baseline dopamine drops. This is very scary because a lot of people are overweight or they have binge eating and they turn to these drugs as a way to self-medicate the fact that they already have a low baseline dopamine. And so you're actually leading further propagation of the root cause of why you're overweight in the first place. So either you're gonna have to maintain this drug for a very long time until the depression gets really, really bad, or unfortunately something worse happens, or the moment you quit these drugs, you still have a low baseline dopamine, you still have the same issues with food, and actually now they are worse because you have further destroyed whatever dopamine you already had in your brain. Don't worry, the damage in most cases can be recovered as far as we know, and I do have a guide called Dopamine Brain where I explain how you can raise your baseline dopamine levels, and so I will link it in the description box below for you. Another key highlight that they mention in this paper is that low baseline dopamine, the way that they refer to it, they call it hypodopaminergia, meaning hypo, low, dopaminergia, baseline dopamine. So they say that hypodopaminergia and those at risk for substance use disorder and depression can be identified using genetic testing. So they're recommending that people get tested with a gene test to ensure that their baseline dopamine isn't too low so that they're not at high risk of those mental health problems. And I think also that's a nod to one of the key authors, Dr. Kenneth Bloom, who has his own company that can do the testing to see if you have low levels of baseline dopamine or D2 receptors and a bunch of other neurochemicals in the brain that are associated with addictions and depression and things like that. My recommendation though is save your money, because regardless of whether or not you have the gene, around 30 to 40% of the population we already know have genetic variants that set them up for higher risk of addiction and depression and mental health issues. Those are the people who end up struggling with weight issues or reliance on substances. So it's a pretty common trait, and you would already know if you have that or not. And even if you go and you do the gene testing and it shows that you don't have that, but you come from a history of using substances, you've destroyed your D2 receptors or your dopamine receptors in the brain, and so you're gonna end up with a brain that's also at risk, and the gene test is not gonna show that. The gene test only is gonna show your gene, it's not gonna show a life history of destroying your dopamine. And so I would go with your symptoms. You would already know if you struggle with mental health, if you struggle with binge eating, with alcohol addiction or any kind of addiction. And if you have a long history with that, I would save your money. You don't need to get the testing. Just know that you are at risk if you are taking these drugs. And the authors say that understanding this concept that they're presenting in their paper, it can help prevent a second wave of, quote, dying to lose weight, because you literally can become very suicidal if you are at risk and you haven't fixed your baseline dopamine and you end up on these drugs which further destroy your dopamine. And really quickly, if you're interested in knowing how they figured that one out, what they showed is that those GLP-1 drugs They reduce addictive tendencies in the short term, let's say like eating addictive foods or cocaine seeking, and they reduce that by increasing the activity of GABA neurons. GABA brain cells start firing more, and that leads to a drop in the activity of your dopamine brain cells or dopamine neurons in the part of the brain that deals with addiction, the VTA, the ventral tegmental area. They go on to say how taking those GLP-1 drugs, especially chronically, can lead to dysregulation of the dopamine pathway, which in turn causes obviously depression, suicidality, and other mood disturbances. So even if you're losing weight, you're going to be really depressed. And if you're really depressed, you might find other avenues to numb out your pain, and that can really propagate a cycle of making the root cause of their food issues even worse. Another paper published in 2023 reported on 2 cases, a male and a female, that developed depression after around 1 month of taking semaglutide injections. Semaglutide is another one of those drugs, those GLP-1 drugs. The moment they stopped the drug, the depression lifted after a while, but it didn't happen very quickly. And so that's really important. I will revisit why in a bit. Another alarming report was put out in 2023 by the NPR. They analyzed the FDA's Adverse Event Reporting System, or the FAERS, and by analyzing the database, they showed that there was 489 reports of patients experiencing anxiety, depression, or suicidal thoughts while taking these drugs, including Ozempic, Wegovy, and Rybelsus. And in 96 of these reports, the patient had suicidal thoughts. 5 of them died. It isn't known if Ozempic and the other drugs cause the mental health problems. The FDA database can flag the questions, but it isn't designed to answer them. But they were reported, and so that really causes us to pause and really think about what we're doing. If you already know you're struggling with mental health, or even if you're struggling with binge eating or emotional eating, which I think that characterizes most people on these drugs. So if you're watching this and you're worried if you have mental health symptoms that are getting worse or starting to get worse after you started taking these drugs, I will obviously highly urge you to stop taking them. And do not expect your mental health to go back to being good right away. That's because what do these drugs do? They slow the motility of your digestive tract, so you're not digesting your food quickly enough. We know that a slow gut motility is the biggest factor for people developing gut health issues like SIBO, small intestinal bacterial overgrowth, or candida overgrowth. If you have candida overgrowth, you're going to have yeast infections that don't go away with antifungals or that they keep recurring. You might have acne, brain fog, you might have dandruff, toenail fungus, the list goes on and on. And if you develop SIBO, you might have digestive issues like burping, cramping, gas, diarrhea, and or constipation. Also, you might develop reflux from all of these issues. And of course, eczema, acne, skin conditions, autoimmune conditions, I mean, everything that could go wrong might go wrong the moment your gut health is compromised. So, if you get on these drugs and they're causing slow gut motility, and you develop the SIBO and the candida, which is very common. I mean, most people are developing these things even before they get on these drugs, let alone when you add in those drugs to the mix. And now you're aware of the link between mental health getting worse and taking this drug. I would recommend the first step is take the drug and then be very patient while you heal your gut. Because to eliminate the SIBO and the candida overgrowth and all the gut health issues that start to happen from slowing down your gut motility, it takes time. It really takes months. In some cases, it can take years to really clear out those overgrowths. A quick tip is that if you follow a carnivore diet, I've reported on cases whereby a woman cleared her candida in 43 days on a carnivore diet. Then I've reported on a study that showed that just 2 weeks on a carnivore diet can eliminate SIBO. And now that we have more studies showing in even larger sample sizes, also carnivore diet really clearing SIBO the quickest. Keep in mind though, a carnivore diet in some cases might not be enough or fast enough to eliminate candida or SIBO or other gut health issues. You might need to throw in some antibiotics or herbal antimicrobials or antifungals or herbal antifungals. I generally recommend going the more natural route. It might take twice as long with the herbal antifungals and herbal antimicrobials to readdress the balance in your gut, but you are less likely to kill off the good bacteria and the good yeast that is supposed to populate our gut at the same time. The silver lining learning from this data is that maybe this will help push people to finally address what they should have addressed years ago, or maybe if they had the knowledge they would have addressed years ago, and that is everything starts in the gut. And when you heal your gut and you eat foods that will heal your gut, similar to a carnivore diet, you will naturally also eliminate emotional eating, you will eliminate cravings, and you will eliminate this food focus, and you will have that same food freedom that people are reporting on these GLP-1 drugs. If you need personalized support, I offer one-on-one coaching, and you can check out the packages on DrZaldivar.com/coaching. You can also join my group coaching. We start at the beginning of every month. So at the beginning of May, we're gonna start a new cohort. You can check out the details on DrZaldivar.com/group coaching. The current schedule is Thursdays at 2 p.m. Eastern and Sundays at 11 a.m. Eastern. That way you can have all of your questions answered, and you can have the support of a group that understands what you're going through and can help you get there a lot faster. And if you got intrigued by the carnivore diet, I will send you a free guide, my 30-day carnivore diet challenge guide, when you sign up to my newsletter at DrZaldivar.com/newsletter. Please share this message with your loved ones if you know somebody who is on these drugs, especially if they are prone to mental health issues or binge eating or emotional eating. Those things tend to get worse when you're destroying your dopamine receptors and you're destroying your dopamine brain cells. That way you can help their mental health, and you can help them also find this information easily, because it's very difficult to get this kind of information out there and being pushed out by the algorithm. I hope this was helpful. Thank you so much for watching, and I will see you in the next one.